Hi, my name is Brandy Butcher, and I'm doing component 7 for the SIMPATH BSN program for SIM 440. It is the home safety assessment. For this assignment, I will discuss the health and safety and environmental hazards. I will identify and prioritize 2 health and 2 safety and 2 environmental hazards that were found in the home during my assessment in Sentinel City. And then I will also provide evidence-based rationale to support my prioritizations and recommendations for addressing each hazard identified. So the health hazards that I identified, there was a mouse running across the floor in the apartment, and also there were dirty dishes and old food laying around on the floor. So the evidence-based rationale for that is, according to the CDC, rodents carry a multitude of diseases. So according to the CDC, there are 11 different viruses in which could be carried by a rodent. So with that mouse running around, it puts them at risk for infection. Not to mention, it's unsanitary to have a mouse in your house. So my recommendations would be to clean the house thoroughly and disinfect everything, and to get mouse traps and put them out to get rid of the current infestation of mice. As far as the dirty dishes on the floor and laying around, they have a 2-year-old, so she could be in the vicinity and eat the food, or choke on the food. So we don't want her to get any foodborne illnesses from the old food that's left out either. Safety, there was a pill bottle left on the table within reach of the children. The CDC recommends that about 50,000 young children end up in the emergency room each year because they got into medicines when an adult wasn't looking. So these can be avoided by just putting the medication up out of reach of the children. Make sure that if it were to be down where they could get to it, to make sure that the safety cap is locked. A good prevention is just to teach medication safety to your child. Let them know that it is not candy and that they shouldn't touch the medication. They shouldn't take anything without you giving it to them, or their doctor, or someone that they stay with. And then also just tell your guests that come into the home about medication safety, because you don't want your little one to be able to get into their purse or pockets of their jacket and get into their medicine either. And then if they were to ingest some medicine, it recommends on the CDC website to call the Poison Control Center at 1-800-222-1222. And then the other safety concern was, it appeared that there was a window open in the apartment and there was no screen or barrier to the outside. With her having small children, there's no way that she can keep an eye on them every second of the day. So it just puts them at risk for injury if they were to fall out of the window and get hurt. Environmental, multiple things were plugged in across and stretched across the floor. I saw multiple, I don't know if they were extension cords or what they were, but they were stretched out across the floor. According to the NCBI, that there are multiple slip hazards, and that there is a substantially average increase for everyone if there are things that are cluttering the floor that you could fall and get hurt on. So these are completely avoidable. And then there were also trash on the floor and furniture throughout. This goes back to also, just cleaning up everything and making it a more livable environment. And the health and safety of the children for these multitude of problems is definitely greater priority than anything. So if she's going to continue to live there, then she needs to just work on getting everything cleaned up. If she needs extra help, she could ask for help. And then to follow up with these outcomes, I would recommend that a weekly visit be done, whether it be by a nurse or it be by home health or even CPS, just to make sure that the living situation is adequate for the children who are staying there. Thank you so much.